Hello everyone. So I welcome you to my live Q&A session. I'm just waiting for people to join. Hi Tasneem, welcome, and hi Subrat, hi from Orissa. Subrat, do you have any question? Hi Miss Roshni. Hi Bella. Please feel free to ask any questions if you have any. I guess in the last session and sixth one, I really focused on the techniques and also important counseling points for breastfeeding. So just remember to kind of, reiterate those points when you help mothers, because many times, we may focus on just a latch, but if mothers don't know other points, baby may not gain weight. Subrat, you have a question. It says, during C-section after surgery, when baby comes out, at what time the umbilical cord should be cut? So, many centers, they use something called Lotus Technique. So in Lotus Technique, what they do is to basically, they wait for the placenta to come out, and then they cut the cord. So they allow placenta to completely kind of come out, and it is used in SSG hospital in Baroda and probably many more hospitals, and that would prevent hopefully anemia in young children. Do we need pillows to support babies while positioning, especially large size babies? Roshni, what I recommend when you're trying to teach the latch to the mother, in that when the baby is small, I recommend that initially not to use pillow. Okay, because what happens when sometime when mothers use pillow, either baby is too low or babies is too high. Okay, so at least while you're teaching the latching techniques, and till baby gets the proper latch, I don't recommend putting any pillow. Let mother control the baby completely, okay, including baby's neck. And once that latch comes on properly and mother is comfortable, once she examines the latch, Then once she brings that hand around baby's body, then you can put pillow underneath. There is no problem at all. But while mother is trying to latch the baby, at least in first couple of weeks or so, because she's still learning to latch. And once she becomes expert, then she would be able to breastfeed even while standing. So that just remember that. But as you can also try putting pillow and see how it works for you. But somehow it while I was teaching mothers, I found it kind of much more easy to teach her when she was in full control of baby's body and neck, without any pillows. What are the benefits of skin to skin contact after post delivery period? Too many benefits. First of all, of course, remember that microbiome, right? Mother's bacteria and baby's bacteria. So that contact of mother's skin and contact of baby's mouth to mother's breast, that's the first contact where basically there is a skin, mother's skin bacteria going into baby's mouth. Extremely important. Another thing is once you have skin to skin contact, it will what it will do, it will help with stabilizing the temperature of the baby, so those babies will not become hypothermic. Hypothermic is with the temperature will not go down. Second thing is it also helps with latching. Okay, so babies who are kind of brought skin to skin right away after delivery, and if they can latch on their own, because in that position baby is upside down, so the gravity helps. And when the gravity helps, that baby opens their mouth pretty wide. Only thing you want to make sure that the mouth of the baby is lower than breast. Okay, so baby will try to crawl and they'll latch on. Okay, try not to have baby's mouth higher than areola. Okay, because when you have a higher than areola, then the upper areola will go in the mouth. So try to keep the baby a little bit lower than the breast, and baby will kind of crawl, and that's called breast crawl. So many other advantages. Another thing is when baby latches on early on, immediately after delivery, mothers get more milk, and because breast is so soft during that time, it becomes easy for baby to learn to latch. So that learning is also important. And in my experience, when we waited for a little bit longer to latch, like some of this hospital, they don't start breastfeeding right away. And when we train our trainees in hospital, a lot of these babies are not given breast milk for almost 12 hours, 14 hours, thinking that mother had cesarean section. And those babies, we had very difficult time latching, even 12 hours difference, So do not wait for that long. Just immediately as soon as baby is born, just put that baby on, and you have already seen our tutorial on breast crawl during a cesarean, so not only just regular, breastfeeding, just normal vaginal delivery, that skin to skin and breast crawl is important, but also during cesarean. And once mother comes out of cesarean section, say once she comes out of OR, you want to make sure that baby is on mother's tummy throughout, so that we don't break that skin to skin contact. Okay. Okay, Dr. Poonam, I tried cradle position for 7 kg baby 3 months ago, but it was difficult to hold. I made baby sit on the lap with back support. Is it okay? Yeah, Dr. Poonam, whatever works, okay. Cross cradle, we found much better weight gain in first few weeks, because what happens is mother can control the neck, okay, within that cross cradle hold, but once a control comes in 6 to 7 weeks, then you don't have to do cross cradle. What mothers do in our experience, they bring the baby in a cross cradle position, but then basically if the baby becomes bigger, what they do is while latching they bring the baby in cross cradle hold, but then they take the baby in a cradle hold and they remove this hand. But this is only, I recommend this only if baby has a good neck control, baby has learned how to latch, mother has learned how to latch. So you don't have to continue cross cradle hold after 6 to 7 weeks, any hold is fine. Cross cradle in my experience, and also a lot of programs that I work in, they just found cross cradle much easier for baby to gain weight because mother had a full control. of that neck. But if once the neck control comes and once baby knows how to latch, mothers know, then you don't have to keep doing cross cradle. Absolutely not. Okay. Uh, Okay, cross cradle, yeah, yeah, Dr. Purnam, cross cradle would be difficult once baby grows a little bit older, and they grow very fast, you know. So, and if another thing is, if baby is growing really well on any hold, you don't need to change after a couple of months, you know. Let the baby, yeah. But what we do in the field, we get a lot of babies who have not gained weight for 3 months, 4 months in the field, and you know, a lot of urban and tribal areas, you know, I'm talking about underprivileged areas. So those babies we still try to get because they are so underweight that they don't have neck control, they are very small. So those mothers we try a cross cradle hold in those small babies, you know. But when you have a 7 kg baby at 3 months of age, there is no way I would recommend to change any hold. I think mother is doing excellent. Don't change anything. Just tell her to continue whatever she's doing is fine. Okay. Cross cradle is primarily at birth, and for 6, 7, or maybe 8 weeks till baby has good neck control. Okay. All right. Okay. Any other question? Anything else that you may have? Uh, uh, okay, so here one request is to take more sessions on parental nutrition. So this, you know, this particular sessions, you know, this MIYCF is primarily for field workers in the field, you know, and also more of maternal, infant, young child nutrition. This is not a pediatric nutrition that I'm taking. It's not actually for doctors, but unfortunately, doctors are also unaware of this cross-cradle hold and a lot of this, you know, new things that we have worked on, type 1, type 2 nutrients. So many doctors have joined, but to be frank, this is not a pediatric nutrition course that I'm taking. This is primarily on maternal, infant, young child nutrition. So on maternal nutrition, pregnant mothers, lactating mothers nutrition, you know, your breastfeeding, and also in breastfeeding also I'm not going too much in detail about you know, other you know, breastfeeding in other conditions, and also complementary feeding, because that's where, you know, we have an issue in India, that because we are not doing it properly, and that's why so many of our children are going, you know, they are not gaining weight. Parental nutrition becomes very specific, and it's you know, it's very small number of children that may need parental nutrition. So this is not a specialized course. So sorry about that if you had that expectation. Many times mom complain the baby does not drink for more than 5 minutes on breast. Absolutely, you know, Dr. Poonam, what we see that many babies are very strong. Okay, so their sucking power is extremely strong. So like if you look at all my videos, I've never mentioned how many minutes baby should feed. You know, it's some children will finish that breast in 5 minutes. Some children will take 30 minutes, sometimes 40 minutes. So it all depends upon basically how the power of sucking is in that baby. So don't go by minutes for sure. If baby is gaining weight, then you don't have to worry at all. And I generally never tell mothers that, okay, feed 15 minutes, 20 minutes. We have so many cases where babies are like just literally, they gain more than 40 to 50 grams just in 7 minutes they finish the feed. Okay, and that all depends upon, again, the position, latch, you know, baby's mouth, the way baby kind of does milk transfer, you know. So yeah, I don't go by time at all. Sometimes not a drop of colostrum is seen on hand expression on delivery table in the first 2 days. So difficult to convince parents and grandparents that it is there. Yeah. So Roshni, please learn how to express milk. Okay. It will come in my next session. I think in session 7 I have explained in detail how to manually express. Do not try to express and show mothers whether milk comes or not. Okay, as soon as you put baby on breast, with as soon as baby is born, you know, with that sucking power, and of course with the removal of placenta, that milk will start forming. Okay, so and babies are on ketosis, so they don't need too much of milk to have that glucose going, you know. So I would recommend that not to keep pressing, but if you really want to, and because more you press, normally what happens, you know, mother gets into the anxiety that I'm not getting milk, so the oxytocin, the reflex will not come, the letdown reflex will not come. So just let it be, and you tell mothers that let nature take care of it. Just put the baby immediately, even in cesarean, push that skin to skin, push that breast crawl, push that immediate, kind of putting baby on the breast, and you will see the results. And once you understand the PCR, press compress release technique, you will start seeing. And again, on day one, again you will get only like 5 ml per feed, which is just 1 teaspoon, from one breast. So I would not worry at all about not getting milk, and of course, when baby latches on directly, the latch is good. And if baby is removing little, even just few drops effectively, then every feed that milk increases. So I think if we keep pressing it, and if milk doesn't come, mothers get nervous. So I won't do that. I don't recommend that. Uh, Okay, perfect, Dr. Punam. Perfect. You just recommend whatever works, whichever position works. It's just that cross cradle does work better in small babies. It works in, even in normal born babies. I mean, I keep posting pictures that a lot of these babies, they become 9 to 10 kg by the time they're 6 months old, and pretty much all of them are cross cradle hold. And I've not seen this kind of weight gain in cradle hold, you know. So very rarely, in your case, probably it's a very kind of outliers, but cradle hold gains so much of weight, which is good. Uh, what about the concept of fore milk and hind milk? In case we don't tell about how much time baby, So again, Dr. Poonam, you have not seen my session 6. Okay, I have shown very clearly that it's not by timing that your fore milk and hind milk comes. Okay, it's by how fast the baby is drinking milk. Okay, and to know whether you have fore milk or hind milk, you have to teach mother how to express manually a little bit. Let mother see it, do more of objective examination rather than subjective examination. And once you teach that mother, she realizes, okay, this is still a fore milk, she has to put baby back on that. So I go not by timing, but I go by whether that breast has good flowing fore milk and good flowing hind milk. If there is a good flowing hind milk also, like the back part of the milk, that opaque, very thick milk, I tell mother to go back again on the same side. Unless the milk becomes so little that it just comes in drops, that means, that milk is complete, and then you can, work the baby, just give rest for a couple of minutes, let baby sit. I prefer that sitting position, because immediately baby will open the mouth, and you then put the baby on the other side. But definitely not to go by timing. Okay. All right. Is it fine to give some amount of formula on? No. Why do we want to give formula? I mean, what is the reason of giving formula? I don't see any situation where the baby is born healthy, and even if it's cesarean section, or even if those, if you focus on the technique of breastfeeding, you don't need to give formula. So I would not think about formula at all. You know. Parental insistence, yeah. So that's why I do recommend to start early on. I think in India, what we need to do is to start, antenatal kind of visits to pediatricians and lactation consultant. I think that's what we do in US, where all to be parents, they have a visit with pediatrician, with sometimes lactation consultant also. They want to discuss their like their views and what our pediatricians view, and they make decision based on that. And during that visit, especially what I used to do is to tell mothers that there are some techniques that, I mean, not, of course, that time I did not know much about breastfeeding, but what I recommend now is to really kind of teach mothers those techniques beforehand, so that she already knows. So try to increase, I mean, what we can do is to push for that culture where mother starts thinking of breastfeeding from third trimester onward. I think that will really help a lot of our mothers, because there are so many myths, not just by family members, but also by doctors and nurses. Doctors just don't allow mothers to breastfeed when baby is born by cesarean. I think all the pediatrician on this forum know about that. And I think we just have to kind of, it's difficult to change doctors' mindset, to be frank. It's not that we don't try, but I think it's better to just go at the family, teach them, educate them, show them all these tutorials on importance of breastfeeding and complications of formula, and then focus on technique, and you won't go wrong. Okay. All right. What do you recommend for okay, saggy breast? Apart from breast support, as some mothers okay, cannot judge effective milk transfer, she cannot see the baby do uh, okay, Surbi. Yeah, so main thing is, suppose if breast is really saggy, you can try kind of football hold and see, you can, if mother is having easier time, or you can try to keep the baby more kind of in a diagonal position. Even only thing is cradle hold, it would be difficult, so you can try different. Even with cross cradle, you can try diagonal mode. Only thing in that, then you'll have to make sure that you're holding the breast. Your finger should be parallel to baby's lips. So that you'll have to be careful. But yeah, saggy breast could be kind of, it's a little bit um, you know it's difficult, but you can just practice, and I think you'll be able to do it. In saggy breast, C shape hold might be better, but then baby will have to come more like kind of in a diagonal position, or more like upright, like a football hold. you know all right. Parents concentrate more on pre-birth. That's so true, Dr. Poonam. So true. What she's mentioning is, mothers are more focused on pre-birth photo shoot, than actually thinking of, baby's feeding, or what she would like to do. And that's so true, Poonam. I think that's where we come in the picture. I don't know how to take this message to gynecologist. Or another thing what we can do is to maybe kind of connect with those photographers and tell them that, please talk about other issues, like about feeding and other things. But like, we have to figure out how we're going to pass on this message, that more than photo, it's baby's feeding at birth, and first 2 days, the first 1 week is more important. But it's tough. It's tough. But we'll figure out, Poonam. Okay. All right. So Surbi, breast size, yeah, breast size is, and that's why I'm so particular about holding the breast and contouring it, because whatever may be the size of breastfeeding, if you can contour the areola and make it smaller so that baby can latch on, that's the key. Okay. So again, big size breast, small size breast, it did not matter in my program, to be frank. I was so focused on contouring that breast, and I was just trying to figure out that, okay, how far the finger should be, and where should be the U shape, and exactly on that. So Sylvia, I think it will come. It will come. Just practice. I think practicing on contouring the breast, and you will get it, because a lot of your questions are very practical. So unless you try it yourself, try what I have said. If it works, good. If it doesn't work, try your own way of figuring out, that how to get that big breast in baby's mouth. It's all about the lower areolar latch, actually. So if you can get that right, I think other things are very easy. Does the quantity of colostrum is same in all mothers? If so, why some mothers develop heaviness and fever? So, Anshu, yeah, there are a lot of variables in that. Okay. Now, some mothers, suppose for example, if baby has a perfect latch at birth, okay, in a breast crawl mode, if baby is latching on the lower areola, has a big mouth open, and it's kind of vigorously sucking, that mother is going to get milk much faster. Okay. She will get even higher amount because the stimulation is so much. And you have some mothers who are not breastfeeding right away, baby is small, not sucking properly, latch is not good, so then you don't have proper stimulation of the areola. Okay. So that stimulation is very important, that milk transfer is very important, the timing is very important. For example, if baby is feeding say every hour and a half, 2 hours, and first day, you may have babies who are sleeping a lot, you'll have some babies who are really vigorously sucking. So your colostrum is depending upon basically that factor, that how much colostrum is coming out. More sucking, more stimulation, milk. Okay, oxytocin also plays a very important role. So if mother is very stressed, if she's in pain, if she is getting mixed messages from everybody, she will not be able to have a letdown reflex. So keep her calm and composed. If you train her during pregnancy, that really helps a lot. So the colostrum quantity depends on so many factors. So again, if you go step by step and try to get everything right as much as possible, and train your staff around you, around mother, to be very calm and very confident, and then mother will get confident. Okay, antenatal counseling is really what we need to stress on. That's absolutely, Shilpi, and Poonam, myself, we have to now try to get all these pregnant mothers, maybe go on some forum or some kind of or maybe connect with OBGYN to have this message going. uh, what should be the approach in a mom with silicone implants in the breast? So that's a good question. So that depends upon where that implant was put. Okay, so if implant was put around suppose that suppose there is an incision around the areola, in that mother may have a problem, basically breastfeeding. Okay, because there in that probably there is a lot of damage to that collecting duct, those duct which are around the areola. So in those mothers you may have problem. But if you have a breast implant which is placed from underneath the breast, basically from underneath the breast, means from here, if you have a kind of incision over here, then there should not be a problem. But if you have an incision which is around the areola over here, then they would have, because there will be damage, so it depends upon, I don't know if India they do this implantation through areola incision or through underneath the breast. Okay, so we can find out more, but this is what literature says, that if you have an areola incision, that those mothers will have difficulty breastfeeding. Okay. If lots of milk, then one breast, sometime 2 to 3 required to empty, that to give hind milk. Meanwhile, other breasts get engorged. If lot of milk, then one breast, sometime 2 to 3 feeds required. No. So Roshni, I think this concept needs to be clear, that when you're feeding the baby, okay, suppose you start this baby on right side, okay, and then you, as soon as baby finishes on one side, you examine with manually express the milk, make sure that milk is coming out in drops. Before you put the baby on the other side, you make sure that you make baby sit in a sitting position, because many times what happens, a lot of these babies, they just sleep on one side, and mother put those babies immediately back into the crib. So don't do that. What I recommend is to you keep baby in a sitting position. Within 2-3 minutes they'll start opening their eyes, and then put the baby on the other side. And then next time when you feed that baby from the other side first, and then go on this side. So you have to alternate your breast, while you're breastfeeding. Okay, don't feed from just one side thinking that, oh, that hind milk is still there. No. It's basically, first you feed on one side completely empty. In the same feeding, you make the baby sit and put the baby on the other side. By making them sit, I've seen the children wake up so fast and they are ready to feed again, so that sitting position is, I use the sitting position more for waking up the baby than burping, actually, because when you have excellent latch, babies don't need to burp, because obviously there is no air going into the mouth, right? Because the latch is so good, there is beautiful vacuum being created, suction being created, so I don't see a lot of kind of air, kind of air swallowing. So I don't see a lot of burping, but it just, sitting position is more for to wake up the baby. As soon as baby wakes up, you put the baby on the other side. So that's what I like. That's what my experience is. Okay. 3 of my moms are on exclusive breastfeeding now. They visited me at 1 month post delivery. And thanks to MI, Poonam, thank you so much. They are now on exclusive breastfeed at 5 days post visit. Okay, Poonam, please monitor these babies. Okay, monitor their weight. This is what we do in the US, actually, and this protocol I follow in India also in all my programs. I follow this baby up every 2 days. Okay, because my goal is that my goal is pretty high goal. I expect 40-gram weight gain per day. Okay, so if you have 40-gram weight gain per day, that means you are sure that mother knows all the techniques, all the skills, and also other aspect of counseling. And till the baby gains, I mean, you can go up to 30, 35, but I know that I can definitely kind of teach mother so that she can even get better than 30 grams, because as per WHO is 42 gram per day, as per WHO growth chart. So you want to have at least 42-gram weight gain per day for at least 5 weeks or so that they are on that same percentile line. At least I'm talking about the average children. Okay, so that's what I do, and every 2 days or so. And so if suppose if mother is affording, or mother can afford, just buy like a small infant weighing scale at home, say 2,000, you get it. These are for mothers who can afford. Okay, I mean, obviously in most of the programs that I work in India, they can't afford anything, but you can ask them to just kind of weigh those babies every 2 days or so and see what is the weight gain. But you may need to have just maybe 2 or 3 more visits, Poonam, and if the latching and if that understanding of 45 points are good at the time of birth, then you may not need to do, but just do a couple of checks, so that like you ensure them. And even mothers get so happy when they see, oh my god, baby gained 100 grams in 2 days, and then that behavior change comes on so beautifully. And then once they gain such beautiful weight, Poonam, what I see that at 6 months it becomes so easy to for behavior change when it comes to complementary feeding. So like whatever you tell mothers, she will do it, whatever you tell her. So get this first 2 weeks right, and then you have that mother for lifelong, believe me, especially when it comes to nutrition. Do you believe that physiological engorgement exists? Most of these mothers are demotivated as the milk doesn't flow freely. The thing is, should be, it's all about latching and milk transfer. Okay, it's all about latching and milk transfer. So if in first 2 days, if you have taught mother proper latch and proper milk transfer, of course in day 3 mother will have that milk flowing in, because that she's getting that milk is coming in. So but if the latch is good, if the milk transfer is good, as mother is getting in milk, baby is removing it, right? And that's why you will notice that day 3, day 4, so many times babies are gaining 60 grams weight gain. 60-gram weight gain, I'm not kidding, day 3, day 4. Okay, this happens when your first 2 days you have worked hard to get that perfect latch, and then those are the important counseling points. Okay, do a study and let me know what your experience is. Okay, but yeah, I mean, there is definitely physiological, I wouldn't call it engorgement, it becomes it is full, so breast is full definitely by day 3, day 4. But teach that mother the milk transfer, no, and then that milk, it will get emptied. And what happens over a period of a few days, that it will get adjusted, and then she will not feel at all that fullness of breast. And sometimes then she feels that, oh my god, I'm not getting enough milk, because she's not feeling the fullness, right? So again, that's another time that you're going to tell mothers what to do. I mean, nothing to worry about if breast doesn't feel full, because now breast is adjusted to whatever baby's requirement is, right? So this are all again counseling points that you will be doing while helping mothers. Okay. Okay, how to motivate such a mother as we cannot control the areola? Surbi, this is again practice. You practice it. Okay, it's these are all skills. So unless you practice on the mother, unless you practice, first of all, I want you to practice on the breast model. Okay, so you practice exactly where the hand should be, where the finger should be, how the U shape should be. This is, and it should be only tip and not the whole finger. So you practice on the breast model, and then you practice on mothers, and it will come. Do not worry at all. You can try even sideline hold. You can try any of laid back hold also. You can try other different holds. You can try and just practice different. Remember that your finger should be parallel to baby's lips. Finger should be parallel to baby's lips. It's like this. Baby's opening the mouth. Okay, so your finger should be parallel. So in whatever position that baby is, if baby is horizontal, like this, then you want to make sure that this baby has a lips which are vertical, right? So then again you will be holding your kind of areola in a vertical position. Okay, but where to put fingers is another key. It's a skill where to put fingers, like how far. So I mentioned it should be 3 fingers away, and again just a tip, and it should be exactly 3 o'clock and 9 o'clock position. Okay. Okay. Shilpi, as LC, we shall start pre-birth photo shoot. Yeah, I will join you, Shilpi. Uh, Good afternoon, ma'am. Please explain complementary feeding for preterm child. Kiran, that will come. Okay, we still haven't finished breastfeeding, so complementary feeding will come in next. We will start from ninth session. So ninth and 10th is all about complementary feeding. So I will answer your questions that time. Okay. What should we advise mother when baby suddenly stop feeding on one particular breast and suckles only on the other breast? Tripti, this is again, so what happened? See, first couple of weeks, okay, baby would want to feed every time they wake up, by and large, okay, unless like a lot of time what happens, baby gets something called cluster feeding. So many times what happens that during evening hours, baby will try to feed like 4 or 5 times in the matter of 2 hours. Okay, they'll feed and then they will sleep for good 6 hours. Okay, so in that time I tell mothers this is cluster feeding, nothing to worry about. Let baby feed as much as baby want, and then let baby be, right. Sometime when the baby has colic, okay, in a colicky baby what happens is during evening hours, again say it starts around 5 p.m. and it goes on till 10 p.m. 11 p.m. and baby just keep crying, and obviously we know that we don't have any kind of real reason why babies cry. There are a lot of hypotheses actually, and what mothers feel that, oh, baby is hungry, so they keep putting baby on the breast and baby refuse to latch because it's not the hunger which because of which baby is crying, right. So again, we have to diagnose what is the cause of baby not latching. If baby is not hungry, baby is not going to latch. Do not force feed. Okay, it's not about force feeding. If baby does not, let it be, just sometimes they just want to play, or just put baby in a sitting position, let that gas come out, let that air come out, because a lot of time when they cry, they swallow a lot of air, so again that will come with a lot of practice, and I won't worry too much, Tripti. One more thing I would like to tell you, when baby is a little bit older, they may not want to feed every hour and a half. They do not want to feed every time they wake up, right. So that occurs around 3 months, 4 months of age, when that frequency goes down to maybe 6 times, eight. First it comes to 8 times, then 6 times, and then mother feel, oh my god, I was feeding 12 times and now baby is not feeding at all, so it's not, the frequency goes down, because what happens, the sucking power becomes very like good, so when they start sucking hard, when they start getting that milk transfer, then they in one feeding they will get so much of milk that they're not hungry for a long time, so I wouldn't worry. And another thing what I would recommend, that when babies get a lot of hind milk, now hind milk is very high in fat. Okay, so that when we have food which is high in fat, you may not feel hungry for a long time. So I would just go by hunger cues. If baby is hungry, try it. If baby doesn't want to latch, then maybe baby is just stimulating, using his hand, I would not worry too much. And mothers should kind of relax and not kind of get too obsessed by feeding. I think obsession is, and many educated mothers, especially doctor mothers, they get very obsessed. नहीं खाना नहीं खाया, दूध नहीं पिया, ये नहीं किया, पिया ना, no, they'll be fine, I think, And so you just kind of monitor growth. No? If babies are growing well, it's not necessary that every time baby will have 50 gram, 40 gram weight gain. Sometimes baby will have little low weight, which is fine, right? You have to look over the period of time. Yeah, when first 2 weeks, 3 weeks, I want that proper weight gain. I want to make sure that mother is learning properly. But after that, I don't stay obsessed with weight gain. Okay. Do you think a mother who developed a milk fistula post breast abscess surgery should undergo session of, it depends. The thing is about again, Surabhi, if you follow this proper breastfeeding technique, okay, you will not see breast abscess. You will not see nipple sore. The fact that you saw breast abscess means that breastfeeding has gone wrong. You should not be seeing any breast. I hardly see any breast abscess and nipple sore, because right from beginning we are so kind of this thing about the mouth opening, a deep latch, all that proper emptying of breast, not to put the tight bra on breast, all that things. If you take care of it, you will not see, and my point in this MIY Safe course, that mother should not have any complication. And if you have any complication, God forbid, if you have any complication, should be really, really rare. Now, for in breast abscess, what happens? If you have a breast abscess on, say, areola, or if you have that, then there will be a lot of issues, because obviously there will be incision around the areola, and I'm so against kind of mother getting breast abscess, and that's why I'm focusing on those so many points. A lot of people kind of tell me that why so many points, why not only latch, why not only positioning. But I said goal of our counseling is not only good weight gain, but mother should not get any complications. So that's why, like, please focus on some of all these important points, and then you should not be able to see any of this complication. And breast abscess is the worst complication that any mother can have. So that's the thing. And again, nipple, if mother is giving only a nipple, that mother will have a lot of complications. So first and foremost complication, the nipple sore, they will not gain weight, then you will have engorgement, then you probably have mastitis, then you have swelling and mastitis, and then abscess, and then incision, and then baby not feeding well on that side, or mother is skeptical. Okay, so let's prevent all that complications. Okay. C-section in the feeding of not enough milk are true impression reason for mothers to opt for formula. Yeah, Roshni, and we have to change that. We have to change that because we are not starting, babies on breast milk immediately as soon as baby is born in C-section. We are waiting for too long. Okay, so we need to change, and let's talk to our OBGYN friends and tell them that let's just encourage that immediate latching. In one of the hospital, actually in SHG hospital, we have completely stopped formula in all the cesarean babies. All the cesarean babies, they immediately get milk, mother's milk, direct latch, and they are doing amazingly well. So we need to kind of we need to stop, or we need to fight all these myths which doctors have, specifically obstetricians. Okay, all right. First day, colostrum amount is 5 ml. So how many number of feed baby in first day generally? So Subrat, that's a good question. So again, go by hunger cues. Every time, what I recommend actually, that in first 24 hours, every time baby opens the eyes or baby is moving even a little bit, put the baby on breast. Okay, whatever, like just every time baby is awake, baby should be on the breast. Let that baby keep stimulating areola, keep having that milk transfer, and believe me, that baby, they do very well. By day 3, they have already regained birth weight, and they start gaining weight beautifully from day 3, day 4 to day 7 onwards. So I recommend that every time baby is awake, baby should be on the breast. Okay. Very good. Any other question? Anything? Do focus on the technicality of breastfeeding. Extremely important, Another thing I want to show you is this one, tucking of baby's legs in the breast. This is kind of, I do push for this one. Okay, and extension of neck is important, so you keep your baby's head extended so that the nose does not press on breast. Okay, and bring the baby in an extended position. Don't bring the baby in a straight head position. If you bring the baby in a straight head position, we will not be able to swallow well. Okay, and I have seen that with extension, the weight gain has been really remarkable. You don't have to worry about the nose part. Directly the lower latch areola comes in. Okay, so this is really a good way of, and then when you bring the baby, make sure that it's nose to nair. It's a nipple to nair, sorry. So babies should be basically, the nair should be looking at the nipple, and make sure, another thing is that baby is not too high up. Okay, so in this position, not too high up. Okay, in a horizontal position, not too high up. In a football hole, baby should not be too high up, because then upper areola will go in the mouth. Okay, it should be here also in this position, baby should not be too high up, it should be lower down. Okay, and in that lower down position, basically you will have to extend baby's neck to able to reach areola. Okay, so those are a few important skills that you want to know. Once you land the baby properly, those babies will definitely kind of latch, very well. Contouring is another one. So focus on contouring also, because if you don't contour it, baby will not be able to have a good amount of lower areola into the mouth. And also wait for baby to open the wide mouth, okay, a minimum 120 degree, okay, and don't be in hurry, because mothers are always in hurry. As soon as baby opens a little bit of mouth, they just try to shovel it in. So don't do that, okay. Okay. uh, Okay, how fast can a mother milk supply get boosted if she is just learning the skill? Survi, focus on the technique, focus on latch, focus on those counseling points. Milk will come in. Okay, so do not worry too much, because if you worry too much, milk has come or not, milk has come or not, all that energy will pass on to the mother. Okay, focus on your thing. Milk will come for sure. Uh, it's more of a technicality of the how good the milk transfer is. Better the milk transfer, faster the milk supply. Okay, so focus on that part and don't worry about the rest of the milk will come for sure. Okay. uh, so swaddling should not be encouraged. The thing is, in India, children are kind of swaddled so tight. Okay, in US now we have stopped recommending swaddling, because what happens is the hip, to prevent this congenital dysplasia, we don't recommend this thing. To swaddle the baby tight, okay, and if you want to swaddle, maybe make sure that hip is not kind of tied too tight, because then that it stays in extension position, and that can cause issue. Okay, so let baby move kind of legs. Best thing, why, I mean, I don't personally recommend. If you want, you can buy those long onsies which covers the legs and hands and everything, and you can just basically put the zipper. This are all basically more for mothers who can afford. And for young babies, of course, at KMC works pretty well, kangaroo mother care and all. But generally, I don't recommend, uh, you know, swaddling the baby. Okay. What about breastfeeding if mother has retracted nipple? Pradeepa, again, if you've seen my session 6, the last part, I think part 5, I have shown one video in which mother has a retracted nipple, and how doctor is basically helping the mother to contour the breast. So it's all about contouring the breast and giving that bite to the baby. Okay, so just contour it in such a way that the whole basically areola becomes like a big nipple, and then try to have that at least the lower areola part, put it in the mouth. So it's all about contouring. To be frank, in past 15 years, I've not seen a single case where we could. First of all, nipple shield, I'm totally against it. So I never used nipple shield at all. We tried all these different ways of breastfeeding, different holes, and cross-cradle hole works the best for me, really. So just work on the contouring of breast, and you will not see the problem at all. And another thing, you want to understand the concept that baby has to latch on the areola, not on the nipple. So if you're thinking of nipple, that mother does not have nipple, that means your concept is still not clear. You're still thinking that it's baby's sitting on the nipple only. It's a nipple latch. For nipple latch, you will need nipple. For areola latch, you don't need nipple. Okay, so that's what I want to tell you. Get your concept clear. See those technical videos again and again, and then practice on mothers who have retracted nipple or flat nipple or any of those nipple. Okay. Okay, saw a patient with abscess and indurated areola on one side who could feed exclusively from other breast for 10 days. Yeah. So when you have a abscess sitting under the areola, I'm kind of a little bit skeptical, So what you'll have to do is you have to keep telling mother to, first of all, you have to get rid of that induration, or just if it's an abscess, you'll have to get that abscess out, obviously pus, but then you'll have to make sure that mother continue to remove that milk, and if it has pus, she'll have to throw it, but she'll have to keep stimulating the breast, otherwise the milk will stop. Okay, that mother will have that dry breast on that side. So make sure that you keep removing that breast milk time to time. And if it's sitting under the areola, that I would not be comfortable feeding that baby on that side. Uh, Okay, saw patient, I think that I said, if it is compulsory to use pillow and CC hold, no, it's not compulsory, Surbi. I don't think. It depends upon mother, right? So if mother wants to kind of put some support underneath, then you can put it. But it's all up to mother's convenience, mother's comfort. Many mothers like it. They prefer once you latch the baby, then they prefer that. Only thing is, one thing you want to make sure that once you put the baby in a cross-cradle hold, don't leave this hand. Keep this hand supporting the neck. You can leave maybe after 6-7 weeks once baby has a good neck control. Once a neck control comes, then you don't need to support the baby from the neck. Okay, but till that time, try not to leave this hand. With this hand, she can bring it in front after seeing the breast latch. She can bring the hand in front, and then you can have a breast pillow, you can have boppy, you can have whatever. Just a plain pillow is fine. Boppy is very expensive, so of course I don't recommend it. Just plain pillow is fine. So it's more about latching the baby, positioning of the baby, and other things come later. Okay, because other things are like, for example, kitni bar pilana hai, how many times this, that, those are all content. Focus on the skill part, because skill is the one which is difficult, right? So once that skill comes, and then whatever, let mother do what, like if she wants to put the pillow, she can put the pillow. If she wants to lie down just in a laid back hold with that, let her do it. Whatever kind of makes her comfortable. Don't be too harsh on her, except for latching part. We don't have to be too harsh. Okay. Um, okay. Any other question? Anything else? I think we covered pretty much, and I'm so glad that you have so many questions on, breastfeeding. And that means that you're really kind of focusing on the technicality. See, one thing is to know the theory part, okay? So, like all those previous lectures were all theory. Another thing is to actually, you have a mother in front of you, and you have a crying baby, you have a mother, you have all his relatives, you have everybody, and they all are looking at you and kind of judging you whether you're doing it correctly or not. So it's very different when you kind of learn, say through tutorial or through reading. Another thing is, it's another ball game when you have a mother in front of you and you're trying to teach. So I do recommend that to practice, find mothers who newborn. You go to nearby hospital, you have urban healthcare centers, you may have primary healthcare center. Talk to doctors over there, ask the permission if you can help. Learn at least, kind of practice on 10 mothers. Show us the weight gain, good 40 grams weight gain after day 3, day 4. Do it for 10 babies. Continue to follow those babies for next 1 year, because 6 months for complementary feeding is as important. And if you can do that, if you can show that, okay, you for 10 babies, almost 80% of the time, or 88 babies, you had 10 kg weight by the time, and again 6 months ke baad, I will focus more on the protein and good fats. So if you can show that, then you will be so confident. But I think that many times what happens is, I'll tell you, the problem issue is that a lot of time lactation consultant teach them in the hospital, but then there is no follow-up. So then what happens to the mother afterwards? A lot of time mothers may not come back to that lactation consultant. So I think it's important to follow up those mothers, find out what happened, whether baby is gaining weight or not, how much baby gain weight. Then you will know whatever you're doing is right or not. So that follow-up is very important, and that's where I think I learned my all my breastfeeding and complementary feeding, whatever that I'm teaching, it happened because we followed those babies from pregnancy onward till up to 3 years of age religiously. Every month we had protocol in practice in urban slum and also in rural areas. So anytime if baby did not gain weight, we had to figure out the problem. So we did, and that was basically our bread and butter. Just weight gain, weight gain, weight gain, length gain, weight gain, length gain. So all that was our bread and butter. I was not practicing emergency pediatric or any kind of sick baby care in India at all. So that was my goal, that I want to get this baby's weight up, because of course we were dealing with very poor children in slums, right? And the children, they were already, to begin with, they were small, mothers were small, right? So we were fighting against all odds, and this was from slums. So again, they were exposed to dirty water, poor sanitation. In that context, if we could gain such children's weight, say 10 kg by 1 year, if sometimes they were 10 kg by 6 months, 7 months of age, then then our other babies, privileged babies, is much easier to do it. Only thing is that a lot of time, educated mothers, they have a lot of questions. They are, it takes time to convince them. While in poor mothers and unprivileged mothers, it becomes easier because they listen to you. So that one thing, definitely we had that advantage. But again, all this, whatever advice that I'm giving, it's coming from field work, field experience. We tried to so many things, and trial and error methods, I would say, and that's when and then you will learn too. So it may happen that when you start really practicing a lot of this different holds and complementary feeding advice, you will learn so much that and I would love to hear from you, because I'm still learning. So it's important to share knowledge than just one way knowledge. So okay. Thank you, Itri. Thank you so much. Babies, she said that she likes all my classes. Thank you so much. Surbi, the babies with oral restrictions make a shallow latch. So what kind of oral restrictions are you talking about? Are you talking about some trisomies, or are you what kind of restrictions are you talking about? Yes, small babies will have small mouth. There is no doubt about it. But that's okay. When the baby is small, low birth weight babies, we have so many babies who are 1.5 kg, 1.4 kg even. They gain amazing weight, 60-gram weight gain. In fact, today I have posted a couple of pictures. Poonam would know that these babies have gained. One child has gained 80 grams a day. Okay, this is only 2.1 kilogram baby, no birth weight. Okay. And one baby is another one 2.1 kgs, almost 58, 60 grams a day again. Another one 80 grams. So again, if you're concerned about the small baby and not gaining, not opening the mouth, again, it's more of mother has to be very patient. Doctor has to be very patient, nurse has to be very patient, and of course then you can always express a little bit of milk and give that hind milk to the baby if baby has not finished, or baby gets tired, so those we can do it in preterm babies. But again, if we do proper contouring, and that's why I focus on contouring, because when you make it small, those babies, just a little bit of mouth open, and a little bit, I'm talking about 120 degree, and then it goes. Wait for at least 2-3 minutes for baby to open the mouth. Okay. Another thing that I want to tell you, that when you extend the neck of the baby, so when you do this, when you extend the neck, automatically that mouth opens. Okay. So even when we extend the neck, automatically mouth opens. So extend the neck, and you will see definitely better opening of mouth. Okay. Okay. Also, one more thing, avoid putting finger in the mouth. I mean, you don't want to force open the mouth, so don't do that. Just stimulate upper lip with the nipple, and wait and tell mother to be ready, and then immediately latch the baby. So that then being ready is very important for the mother, because a lot of times if she's not focusing, baby opens the mouth and again he shuts the mouth. So that kind of being ready is important for the mother. Okay. Okay, lip ties. You mean tongue ties? You mean tongue ties, right? So tongue tie, to be frank, I'll tell you. Again, in 10 years, we have followed so many babies, and I mean, I would see a couple of babies who had tongue tie, but again, we were so focused on latch that with so much of this kind of sucking and good latch, the fold became kind of a little bit loose, and it was okay. So we were focusing a lot on weight gain also, but I did not need to refer anybody to any ENT or any dentist for tongue tie. So I have not seen any problem with tongue tie so far, you know. Uh, but again, if you have any other experience, please share it with me. But I did not have to refer any child because all these babies, they did quite well. If they were not gaining 60 gram weight, 50 gram, they were at least getting 30 gram weight gain per day, so they did not falter much, Okay. My baby does not empty one breast completely. When I'm putting him on the breast, he again starts sucking. So I think, Kiran, what you need to do, I'd rather that you completely empty one breast and then go on the other side. So even if baby takes just one breast and if baby is full, then you're okay. Okay, because I don't want baby to just get for milk only. Okay, because that baby will have difficulty gaining weight. So if baby is not taking from both sides, then just focus on one. And as I said, keep baby in a sitting position after finishing one breast, and see if you can wake up the baby and put the baby. But then waking up is very important, and I recommend that suppose baby goes to sleep on one side, don't wait for too long. Immediately make a decision, put the baby in a sitting position, put the baby on same side if the mother still has hind milk, or just if that side is over, then put the baby on the other side. But do that quickly, make decision fast. If baby is sleeping, just put the baby in sitting position. Baby is not waking up, put the baby to sleep. Okay. Do not graze the baby. What is grazing? Grazing means that every half an hour baby is waking up, she feeds a little bit, she goes to sleep, she feeds a little bit, she goes to sleep. So do not kind of do that grazing. We don't want to have proper, we want to have proper feed at a time, and then put the baby to sleep, and baby will sleep good to 1.5 to 2.5 hours sometime, and you want to make sure that hind milk goes in, because then baby will not wake up fast. Otherwise, if only watery milk goes, then baby will be hungry in half an hour or so, and that only watery milk will go. We will have some little bit of milk, will again go back to sleep. Okay, so that do not do that greasing part. Okay. uh, Roshni, yes, Rupal, we are committed to spread the word, and course of yours to all the health. It's also recommend to JMC department. Let's hope it works out. Yes, thank you so much. Uh, okay, so anything else? If you have any question, we still have about 20 minutes or so. Okay, so looks like I think questions are over. Do you recommend breast compression in poor weight gain? Okay, so yes, I do recommend. So there is a very good tutorial which is coming up in next session, where I have shown 10 different techniques to improve breast milk supply. Okay, and these are all physical methods. I don't necessarily start any medicine. I'm very strict about giving medicine to mother to increase breast milk supply, because if the latch is very good, if all those techniques are very good, then you don't need to the milk transfer will be so good, and then milk will come. Okay, so Surbi, we will do watch that. It will come in my 7th session, and I've shown like what all things that you can do to improve weight gain, and in that one of the recommendation is breast compression, so you can do that. There are other many more that you will learn in my next session. uh, so far the session is very helpful. Thank you so much. Thank you, Apurva. Thank you so much. I think we will end it now. Um, and if you have any questions, just feel free to ask us on the forum. I'll be more than happy to answer. Just practice, just kind of this is good that you're learning the basics of breastfeeding and complementary feeding, but do practice it on mothers. Do practice. It's not as straightforward as I'm mentioning. I sound like it's easy, but when you have a mother in front of you, you will realize that you will get sometimes tears in your eyes, which I did. So that practice is important, and once you get that proper understanding how to, then you become so confident, and all that confidence shows then in the mother too. So just be confident and show weight gain, and then you can share success stories with us. Okay, so thank you so much, and I'll see you again probably on, I think, 4th or 7th of April. I'll send the email when I have a next live Q&A session. Okay, thank you so much.